I am Chandra Wilson, and I have the privilege and honor of being able to be the national spokesperson for the Cyclic Vomiting Syndrome Association. I came to CVSA as a result of the website and the message board. My daughter started cycling in 2010.
I'm Kathleen Adams, the co-founder and the current, the lifelong president of CVSA.
I'm Dr. B. Lee from the Children's Hospital of Wisconsin in Milwaukee, Wisconsin, and I am the medical director of the Cyclic Vomiting Program, which is a special program for children with cyclic vomiting syndrome.
Sarah Williams. I'm a pediatric psychologist at Children's Hospital of Wisconsin.
Dr. Richard Bowles. I am a geneticist at Children's Hospital Los Angeles and at USC.
Thangam Venkatesan, and I work at the Medical College of Wisconsin in Milwaukee. I am associate professor in the Division of Gastroenterology and Hepatology.
These kids are very complicated, and it really takes a number of professionals, not just a GI person, to deal with a host of problems that we found.
As we see stress and anxiety as one of the primary triggers of cyclic vomiting syndrome in approximately 2/3 of the patients that we see in our pediatric clinic.
We also have found that just recently in a review, over 50% of our children have either limited physical stamina or chronic fatigue that affects their participation in extracurricular activities, even attending school.
Not long ago, it was a huge challenge that nobody knew what it was, or that they accepted it for what it was, and then nobody knew what to do about it. Today, it's more of a challenge that people, at least in the pediatric world, they've heard about it, they believe it, they just don't know what to do about it.
CVS is actually probably more common than it is thought to be.
It's part of a large family, and that this family affects as many as 20% of the entire population.
And a lot of CVS adult patients don't necessarily have the support that's available. So if you're a breadwinner and you're so disabled and sick and you don't have appropriate health insurance, then you really don't have the resources to seek health insurance.
I really come from an angle of educating about stress reactivity in the body. We really try to link that mind-body connection together.
There's a lot of anxiety, depression, there may be other mental health issues, social issues, and so trying to get hospitals, trying to get resources to provide them.
I think there are several challenges. One is not one size fits all. You eventually have to try a lot of different strategies.
We can take patients that have been hospitalized with episodes. They may be vomiting for a day or as long as a week. They may have episodes every week, every month, every 3 months, and we can abolish the episodes, or at least drastically reduce them to a couple a year, and the vast majority of people. And that's something that we couldn't do 10 years ago.
Our outcomes have actually been pretty good. At least about 80-85% of patients seem to get better with appropriate treatment. Unfortunately, there still is a lag really, or the medical community at large is not as aware of this disorder as we would like it to be.
I'm hoping that there's a great awareness. Secondly, that people begin to understand this as a complex disorder, not just a vomiting disorder that goes away, but there are other things that affect these children in between episodes. And the third thing is that I hold out a great hope that we will make progress through research. And we have a lot of good ideas, but actually getting the funding to complete the research and, for example, trials of medications is still the next step.
We have tools that are amazing, that we can look at all of the genes, all 3 billion nucleotides, that we can look at tens of thousands of genes, and that we have the capability of sequencing the computers to be able to analyze it, and the intelligence to at least know some of what we're looking at. But unfortunately, these tools require a lot of money.
Once I think we have a better understanding of how this disease works, we can actually move towards finding appropriate and better therapies than what we have.
To make CVS a disease that everybody has heard about, and you go to the doctor and you get this pill and your vomiting episodes go away, to get to where we want to be is going to take a lot of research, because we're not there yet.
Getting educated and getting connected with other people who go through this is just critical.
When an informed population has something that they're concerned about and goes out and talks about it, then things will happen. And nothing will ever happen unless that occurs.
People that are still out there suffering in isolation have an opportunity to know they're not alone, have a diagnosis, and have hope for the research work that we're doing and the support network that we offer.